My name is Asher Tabrizi, and my project is the Companion Provider Wage Project. My mentors for this project were Mitty Wallace and Cindy Giles. Government Internship. This is a fairly new program added to the Fauquier County Public Schools, and the goal is to somehow improve the county in any way, shape, or form, and then address the goals of the organization, and then collect data and work towards a solution with to improve their why social services. I wanted a better understanding of what my sister does on a daily basis at her job, and she works in Arizona as a social worker. And then I also wanted to give back and help the people who are not as fortunate as me. And the way I'm doing that is being here at social services, and then also I'm going to try to start a clothes drive at Fauquier High School in January. What is a companion? There's an in-home provider, and in this position, the provider would care for an individual who requires services in their home. And there's chore services, an individual who performs non-routine, heavy home maintenance tasks for clients unable to perform such tasks themselves. And some tasks are light housekeeping or just preparing a simple companion provider. Companion services are performed by an individual or an agency provider who assists adults unable to care for themselves without assistance and where there is no one available to provide the needed services without a cost. Job activities, transportation, getting the client from, say, doctor's appointments to just point A to point B, seeing family, and then meal preparation. It's a light meal, no filet mignon and something like that. And laundry, and then just grocery shopping, and supervising them, looking over them, and then light housekeeping, and then companionship, just having someone there for them, looking there, creating a relationship with them.
The research project. Review the case records of the providers to determine how long they were working for social services, the rate they received, to make a comparison of what companions or CNAs make. CNA is an acronym for Certified Nursing Assistant. What CNA hourly rates were around the area, including raise analysis. Collected research for what an affordable raise was. This was done through calling other departments offering companion services to determine whether the department is paying a fair amount. Research goals. To increase the hourly wage of providers, to retain good workers without reducing services to clients, to discover how much of a raise could be given and can it be given in the budget of $69,770, to interview clients to discover if they are satisfied with their services. Standards for providers. First, they must complete the application, provide 3 references, then have a free tuberculosis screening. The tuberculosis screening involves 2 steps: the injection of a small amount of PPD solution under the first layer of skin of the forearm, and an evaluation of the injection site conducted by a health practitioner at 48 or 72 hours to see if a local skin reaction has occurred. Then they must have reliable transportation, attend all trainings, have a criminal history check, and have the ability to work in different environments such as hoarders, pets, condition of the home, dealing with different personalities, and no running water. Then they must sign a vendor agreement. This states the duties, wage, approval period, which is 2 years. Then they must re-sign the contract after going through another criminal history check. They must be over 18 years of age, have appropriate knowledge and skills in home management, nutrition, meal preparation, and personal hygiene. Now, they will not be going to the shower and washing this person. They will just bring the materials needed for things such as a sponge bath, sponge, and some water. They must be organized, have the ability to juggle multiple tasks, and they must also sign a confidentiality statement. And then under law, they are required to report any suspected abuse or neglect. The hiring process. How do people hear about the job? Ads in the newspaper, word of mouth, and in the workplace. The workplace is in the social services office. Then they must complete the application, interview the provider, have reference checks, and most importantly, criminal history checks. Years hired. On the left is the year the provider was hired. On the bottom is simply the order that they were put into the data table. Now if you look, number 5, JC, has been working at the Social Services Department since 2000. The number of companions. Fauquier Social Services has a total of 11 companion providers. And if you look down below, there is a breakdown of the salary. Now, the combined yearly salary of all the providers is $46,920.29. Salary. This chart is an overlay of the predicted income of each companion with the average hours they work within a 3-month span. It is overlaying their current wage and particular salaries based upon certain pay increases.
This is where I called different departments in Virginia and asked how much they paid their CNAs. And the lowest was At Home Care, paying $8 to $10 an hour, and the highest was Best Care Home Care, paying $16 to $18. And Fauquier Social Services pays $9.94. That is also the average of all these departments. And then if you notice here, it looks like the highest, but they're only paying $25 per visit, and it's paid through Medicaid. And then there's Independence Empowerment Center, and they pay $11.70, but it's paid by the state. Here is the affordable wage in both Fauquier County and Virginia. And on the left is the hourly wage, and then on the bottom is the number of people residing in the home.
Median household income. The median household income simply states that 50% of the population makes more than the median, and 50% of the population makes less than the median. On the left is the total household income needed to live in both Fauquier County and Virginia. On the bottom, Fauquier is simply inserted as number 1, and Virginia is simply inserted as number 2. Looking at the 2 points, you can see a major difference in the median household income in the two areas. The cost of living is greater in Fauquier County, which is why the affordable wage is higher in Fauquier County.
Affordable wage. Affordable wage is a wage that's high enough to maintain a normal standard of living. It is also known as a living wage. And in Fauquier, it is $14.50 for one adult, and this is not living comfortably. This is just barely making it by. And for one adult, one child is $26.48, and one adult and two children, $30.86. And the median household income for Fauquier is $88,409, and in Virginia is $63,907. And that is nearly a $25,000 difference. Some social workers here actually make less than both Fauquier and Virginia median household.
Clients. Most clients are over the age of 60 and primarily female. The department is currently serving 33 clients and it has 8 on the waiting list. The waiting list means that they cannot afford to provide services to these clients. Clients receive weekly house cleaning and shopping. And I interviewed 33 clients, 31 over the phone, and had 2 in-home visits. Now, the department does not want to cut services to their clients, and they need an increase in budget in order to provide services to those on the waiting list. The over-the-phone interviews. While making over-the-phone interviews, I came across some covert clients. I called and stated my name and occupation at Social Services. Hi, this is Asher Tabrizi, and I'm an intern here at Social Services. I'm calling on behalf of Mike or Cindy, and I asked if they were receiving services from a companion provider. They seemed befuddled and accused me of extorting any information out of them due to age and pressed the red end call button as fast as elderly possible. Now, it took me a few calls, but I eventually ended up getting the answers out of them. The in-home visits. These were done at Warrenton Manor. On a half day of school, I was given the opportunity to partake on 2 home visits with an APS worker. While there, I met with 2 beautiful aged women. One client was 59 years old, blind and deaf, with a cochlear implant. She was doing well and loved her provider. She could only say positive things about her companion provider. Signing paperwork was not an issue for this woman. She showed me a signature guide, in which she asked individuals to place on the guide on the line, and the rest is muscle memory. The other woman was 100 years old and was also blind and nearly deaf. Getting around the apartment was far from easy. She also had memory loss, creating some struggles in finding the efficiency of her provider, but eventually ended up remembering and telling me. The one problem I saw while I was on the visit was the renovations. Renovations are great and much appreciated, but these elders are already having a hard time getting around their homes. Boxes laid stacked on top of furniture and one another in the corners of the homes, sometimes even in walkways. Finding clothes and getting to their bed, bathroom, and kitchen became an instant struggle. This is a great example of why the companion providers are vital to the daily lives of our clients and how important their assistance is to overcome the challenges of everyday life. Increased pay of companion providers. Raise the hourly wage of companion providers. Can it be fit in the budget, and how much a raise can be given? The budget is $69,770. The budget is created from both state and local money. Who would qualify for a raise? These are a few things I asked clients while I interviewed them. Was the client satisfied with the services provided by their companion? Does the companion work hard and push to complete all tasks? And then punctuality. Is the provider able to complete all the required tasks? Retention. Retaining the companions is important to Fauquier Social Services, unless the provider is not completing the tasks or satisfying clients. If this is the case, the department will take control and lay off the provider and find a more punctual individual. Fauquier. The last thing Fauquier Social Services wants to occur is reducing the services allocated to the clients. Now, due to the rapid increase in the 65 and older population, they cannot reduce the services provided to clients. Fauquier County intrigues the elderly population with beautiful scenery, charming Old Town Warrenton, and the vineyards in southern Fauquier County. This may be a reason for the estimated elderly population in Fauquier County in 2020, which is at an astonishing 65%. Recommendations. The department needs more money in the budget. Fauquier Social Services needs to approach the state and request for additional money added to the current budget. Companions will not receive an adequate increase in pay with a limited budget. Cutting services is impractical. The number of clients cannot be reduced. Fauquier Social Services will not reduce their services to the people who need the assistance. Given the current budget, $69,770, this will not meet the needs of the current clients. The end results. If more money is received from the state, this creates the opportunity for all companions to receive an increase in pay. The companions with greater experience and greater efficiency should be the ones to receive the raises first. If more money is not received, reducing the hours worked by clients is an option, but undesirable. Reducing the hours generates obstacles for the clients who cannot live on their own. A big problem that would occur is that individuals on the waiting list would not have the ability to receive companion services. And lastly, the inability to increase pay could result in failure to retain the good providers.